This category was super, super hard. As you can imagine, the AI category blew up this year, and it blew up in a really powerful way. So this was the competition. We had like 300 or so, 350 applications. So this is a big deal that you guys are here. Okay, so I want to first honor you all and say this is a big deal. Okay, so I'm going to start with Welldoc, Quibim, Butterfly, and Cleerly with you guys, and I'm going to well, since Welldoc, you were first on the list for whatever reason, you get to go. So really want your responses to be around 30 seconds here. And let's talk about, really tease it out. This is the big question. What's that superpower? And you know, what is it that Welldoc is doing that is so important and such a great application of AI that for this year, when the AI award is the #1 award, you need to win this. You need to win this prize.
Yeah, so thanks a lot for the opportunity, guys. I think our solution in digital health makes care models, I would say, more efficient and scalable by integrating directly into care pathways and supporting clinical decision making, if you would, for the healthcare provider, but also supporting the patient on that journey. As a type 2 diabetes patient myself, I have to manage my glucose, my food, my activity, my sleep, the 360 that we call it diabetes. There's a little thing called life that gets in the way. We take all of that data and run it through our machine learning algorithms, run it through our rules-based AI engine to actually provide real-time insights and coaching to patients and insights over time. But we also provide to the clinician, instead of dumping them the data, the insights that they need to know to then optimize that treatment pathway for that patient.
Okay, that's great. So just really super smart coaching and through AI, one way to look at it.
Super smart and super personalized. I always say this is kind of like Google Maps for a patient that says, yeah, I want to get from New York to Boston. And there's many ways to do it, but I may have preferences. Maybe I want to avoid tolls or freeways or things like that. In the same way, if I want to bring my hemoglobin A1C down, my LDL cholesterol down, my blood pressure down, maybe there's certain things or tactics that will work for me that may not be right for another patient who potentially has different constraints or who may be on a different drug regimen. So it's that personalization that's driven by AI that drives these impressive health outcomes that we've been able to show demonstrated time over time in clinical studies.
Okay. Quibim, you get to go.
Thank you. So yeah, basically we design pioneering tools that unlock imaging data from MRI, CT, and PET images that improve patient outcomes and maximize drug programs. And actually, we have developed a unique technology for harmonizing huge amounts of imaging data and achieve a better performance in organ and lesion detection. And indeed, we created QB Prostate, which is an FDA-cleared product for prostate MRI exams interpretation. Prostate MRI is poised to become the main screening technique in the future for prostate cancer, and we can reduce the reporting time in an 80%. Also today, only 1% of radiologists know how to report prostate MRI, and we are democratizing with AI that every radiologist can report regardless of the experience. And finally, our technology also can avoid unnecessary biopsies in around 30%.
Okay, great. Butterfly was actually one of our winners in our first award show. So that was 5 years ago in a different category. So that's why they get to apply again. So it's great to have you guys back, and let's hear Butterfly and AI story.
Thanks so much. My name is Shahida Shah. I'm an emergency physician and director of global health for Butterfly. Our AI solution, which is what we're here to talk about today, is integrated into our handheld whole body ultrasound probe. Our unique ultrasound on a chip technology was featured several years ago, and now we are opening up our SDK for AI developers. The particular solution we're talking about here today was developed in collaboration with UNC. It's an AI tool that automatically calculates gestational age of a pregnancy from an easy blind sweep scanning method with our portable ultrasound device. It can be performed in just a couple of minutes with a provider new to using ultrasound or a relatively novice healthcare provider by easily moving the probe in a standardized fashion across a pregnant abdomen. Our tool is more accurate than the current most accurate mechanism for measuring gestational age, which is a first trimester ultrasound by a trained sonographer. So the thing that's happened since the nomination is we've opened our SDK in our Butterfly Garden to AI developers who seek to make their apps interoperable with our ultrasound imaging. So happy to speak more about the tool.
Great. Cleerly, Jim, you're up.
Yep, great. Thanks so much, guys, for having us, and also for this noble designation of finalists. Like we started off academically, and so we spent about 15 years. My partner, our chief scientific officer, and myself, he's a radiologist, I'm a cardiologist, and we adopted a non-invasive imaging tool called a CT scan to better understand coronary vascular biology and the cause of heart attacks. And so Cleerly represents the translational outcome of about 1,000 peer-reviewed papers, where we didn't realize it at the time, but we were answering the question of why we use non-invasive imaging to prevent the most common cause of cancer, but not the most common cause of death. And we realized that the successful preventive care paradigms were really around individualizing, standardizing, and visualizing somebody's actual disease rather than the indirect markers of disease. And so we developed Cleerly to not really as an imaging company per se, and not really as an AI company per se, even though we use end-to-end AI as a tool to deliver our services, but more as a personalized, standardized, and comprehensive care management platform for evaluation, education, treatment, and tracking of heart disease. And we thank you for your time today.
Great. So basically, you're getting AI to really work on heart disease right now and get it to work. Great. So basically heard four things here, and I'm gonna zero in. So we started with coaching. You got basically AI for prostate cancer, and basically opening up a device, which is an ultrasound device, making AI do a better job than doctors have been in calculating a first trimester. And then we have Cleerly with heart disease. So let's think about the judges right now, and let's talk about the data. You guys are best of class. You have some data. You got some results. I want to really zero in. Are you quote better than a doctor, or are you just there to augment the doctor? But share with us some data. So Jim, you get to go first. We're going to go reverse order.
Okay. Yeah, I think that we can never replace the doctor because the care pathway necessarily entails the physician-patient interaction, but we can certainly standardize and automate it so that they can spend the time educating. This whole teachable moment is impossible for people to do because, one, they don't have time, and then two, a lot of these advanced phenotypic markers that we get from advanced cardiovascular imaging is lost on clinicians, on primary care physicians, on patients, on general cardiologists. And so what our platform allows is for us to do these very, very deep phenotypic analyses on the heart, but then translate all of those findings into actionable insights that can be leveraged by physicians and patients. We can make things faster, we can make things more accurate, but ultimately, I think it's just more usable.
And you're augmenting the doctor. What are you replacing? Anything? What processes or tools or systems or traditional other diagnostics are you? Yeah,
it's a good question. Like I'll answer it in a couple of ways. Like one, when we first started the company, our first product was focused on coronary atherosclerosis, so quantifying and characterizing the plaque that was building up silently in the walls of the arteries over many decades in patients. That had not been done before at scale. So we offered a new metric that people could act upon. Ironically, then what we found was that once we could make these exquisite measurements from what we could see in the image, we could use the outputs of those machine learned algorithms as inputs to future prediction models so that we could then get predictive algorithms that would generate information that would be usable and clinically actionable for doctors in a way they could never do just by looking at the images themselves.
Okay, and data. X%, data, Y% faster.
Yeah, so I mean, data is something that we care a lot about. So we have a large we've had a series of multi-center clinical trials that we've diagnosed or that we've completed. The first were in diagnostic accuracy, where we did about 6 validation multi-center clinical trials against every non-invasive and invasive gold standard that we could think of. Think intravascular ultrasound, quantitative coronary angiography, near field infrared spectroscopy, optical coherence tomography, and so on. And then we did outcome studies where we enrolled about 12,000 patients with 4-year outcomes. And we're just starting to publish on that, and demonstrated that the prognostic or the clinical utility of what we're finding is actually identifying people who need better treatment. And then once those people go on better treatment, we're about a month and a half away from launching an 8,000 patient randomized control trial with hard outcomes as the endpoint to prove that like treating the Cleerly findings improves outcomes over the current standard of care.
Okay, great. Butterfly, your turn. Same 2 questions. I'm happy to repeat them if you want.
That would be great. What are the questions?
So, well, it's I wanted to know what you're replacing.
Okay.
Yours, this is an easy one. This is a
And
layup.
the data. Yes, this is great. So our tool is essentially replacing many things. Around the world, clinicians use a tape measure to estimate the gestational age. They use a sonographer performed scan that a woman might have to wait plenty of time for in a high income country to get. But our tool basically democratizes the ability to provide that information across the world because it can be provided with very little training in any setting. The WHO estimates that 300,000 mothers die a year around the world, and 2.3 million babies die a year in preventable high-risk condition situations related to pregnancy. Ultrasound diagnostics can detect many of these conditions before birth, but they require training to use. So we are committed to providing this training along with our equipment, but really the next step to truly making these tools available around the world is to have them be AI guided. So again, we're not replacing the doctors. I can say that as a doctor, we hope never to be replaced, but we're shifting the responsibility for getting that information away from sonographers and radiologists.
And so when you talked about the AI, the augmentation of AI, I love to get some numbers here. So it's, you know, faster, cheaper, what percent? Obviously, you have yours is dramatically greater accuracy. Do you have any sense of how you can displace the tape measure, whatever system people are using in this first trimester? And give me a percentage. That's what the judges want to hear.
Yeah, and you know, the tool was developed in both US and Zambia on pregnant mothers using the gold standard of either in vitro fertilization, where you know to the day the exact gestational age, or first trimester sonography as the gold standard. The tool is accurate to those standards throughout pregnancy from 9 weeks till the end of term. And so we are able to use the blind sweep technique with this AI when a mother comes in labor to determine whether she's in premature labor.
And do you have any data, like what percent faster, cheaper, like have you been able to bubble any of that up yet?
Yeah, in terms of the cost effectiveness, our handheld that the tool is available on is the most affordable handheld point of care ultrasound on the market. And so the traditional techniques of sonographer performed biometry usually take 45 minutes. The training to make a fully trained sonographer can take up to a year. The blind sweep tool takes 2 minutes. It can be performed with very little training, including just watching a video on how to do it. It's a very, very easy technique. And again, the hardware is less than $1,000 for a probe. So.
Okay, great. Well, that's the money shot at the end. Thank you, Shahida, for that. Quibim, let's move over to you. Same 2 questions. What are you replacing? And then we'll get to, tell me some numbers.
Thank you. So yeah, basically thinking on replacing, one of the things we might be replacing, although we are mainly targeting the epidemic of burnout initially, but we are replacing unnecessary biopsies in prostate cancer. Today, there is a crisis on a high sensitivity and a lack of specificity in most of the readings. That ends up in a high burden for many patients. However, as I was saying, when we introduce QP prostate, basically we allow to reduce that interpretation time. Usually radiologists end up, localizing the prostate gland, having to contour it manually because they have to go for biopsy afterwards. And this can be perfectly done with AI pre-filling a report as well with the volumes and with potential lesions. So that's basically what we are streamlining, both epidemic of burnout on one side and then unnecessary biopsies.
Okay, great. And is it too early for some data? Some numbers, faster, cheaper, but all that, all that.
Yeah, actually, we are engaged in the biggest right now repositories in prostate cancer research worldwide. On ProCancer 17,000 patients. We start to have the very first data on the impact, and we are also doing a pivotal study with MGB, Duke, and university hospitals. And the data we can see now is that we are targeting a reduction of our reporting time in 80%. So radiologists dedicate their time only to what's exclusively valuable from a human standpoint. So they spend around 30 to 40 minutes in traditional reporting. That makes MRI unsuitable for screening, but we know it's going to be the screening technique. The evidence is there that's superior to PSA, and therefore we need like 10 minutes MRI and AI-based interpretation.
Okay, great. We answered the question. Let's move to Welldoc. Same question.
Same questions.
Great.
Yeah, absolutely. So as a patient, I see my doctor 4 times a year to get my blood drawn, have a discussion about how my diabetes is going. All the other times that I'm not with my doctor, I have to do all the things that I need to do. So what are we replacing? We're replacing that dead space where the patient has to make on their own, wherever they are, however they are, all the decisions about their glucose, their food, their activity, etc. So we're not replacing a doctor, absolutely not. We're bringing the patient and the doctor closer together, but we're replacing something that didn't exist. We're actually introducing that FDA cleared. So we have 11 FDA clearances, class 2 medical device, which is what our AI-driven software is. We're replacing something that didn't exist before. We're bringing that moment-by-moment coaching that's safe, that's trusted, that's evidence-based, evidence-driven, and that's scalable because it's all AI-driven software. And so when you look at the outcomes associated with that, we have 76 peer-reviewed publications today. On average, in the diabetes realm, hemoglobin A1C drops of about 1.9 to 2 points. Just to frame why it's important, the FDA heralds a drug for dropping that number by 0.5. So this is 4x what the FDA expects for a new drug to clear. And when we add new data tools and sensors like CGM to that number goes as high as 3.2 in our last publication, 7x what the FDA expects for a new drug. On the blood pressure side, a 7 to 12 millimeter drop in systolic blood pressure. Again, a drug is typically cleared for its FDA clearance when it drops systolic blood pressure by 4 millimeters. So you're talking about 2x what's expected from a new drug. Weight loss of 6 to 7%. The CDC requires 5% weight loss that shows macrovascular benefit. And perhaps the most important one to the payers, the enterprises we serve, on average, a $3,100 per patient per year cost savings, 53% reduction in ER visits. So we're getting a lot of reduction in acute utilization. So we see not only the numerator health outcomes improving, we see the denominator costs going down.
Great. Okay, you actually answered both questions. So we are actually finished with the first part, which is the best of class companies. Now, big part about what we've learned in the awards program is connect with your peers. You guys are all finalists. I bet you're basically all trying to target the same hospital systems. There are a lot of the same people. That's a big part about what we're really trying to encourage. We'll encourage it again in Vegas. You'll all be there. And good luck to the 4 of you. And you're all winners for sure, right? And see you in 2 weeks. And now we get to go to our rising star companies. And I'm going to go company by company. And let's make sure we've got everyone on board here. And I think we do. So I'm going to start. The way we've listed on the list is that I'll go backwards. I'm going to have Kintsugi go first. So Kintsugi, let's basically, if you want, I'm happy to repeat the question, but it's really tease out that superpower and what makes Kintsugi Kintsugi.
Well, thank you for having me. My name is Grace Chang. I'm the founder CEO of Kintsugi. At Kintsugi, we are developing novel voice biomarker software so that we can detect signs of clinical depression and anxiety from short clips of free-form speech. I'm really excited to say that our superpower in developing novel AI technology has really come from the history of developing our technology first through National Science Foundation subsidized grants in both phase 1 and phase 2. From those grants and from the evolution of the product, we've been able to, from those findings, use signal processing and deep learning to allow us to be able to detect voice biomarkers for depression and anxiety. Because we are deployed across different populations and that we are using signal processing, we are able to construct the depression signals and anxiety signals that are language agnostic. So people can be speaking in French, in English, in Spanish, in Chinese, or otherwise, but that is something that is quite unique to the models that we've developed. And importantly, in the institutional focus quadrant, I think it was really important that we built something to not only create timely and real-time data for triage, but an end-to-end clinical workflow that actually gets patient to that right level of mental health care from 11 years down to 4 weeks.
Next company, Imagene. Let's hear it from you.
Hi, Mark. Thanks. My name is Will Brown. I'm the VP of Strategic Partnerships at Imagene. When we think about the aim of realizing the goal of precision medicine in cancer care, it's really critical that molecular profiling is performed on patients in order to make sure that the right treatments are selected, especially targeted therapies. But the reality is about 30% of stage 4 lung cancer patients will die before they even get their molecular results. So what we've developed at Imagene is a technology that evaluates digital images of pathology slides from tumor biopsies. And what we're doing is analyzing that image, detecting patterns that a human being cannot even detect, and within minutes, providing a genomic and molecular profile for that patient, reducing the turnaround time now from several weeks to get those results back down to just a few minutes.
Perfect. That sounds great. Thanks, Will. Regard, you're up next.
Thanks, Mark. Good to be here. Hi, everyone. I'm Nate Wilson, the founder here, one of the co-founders here at Regard. And Regard is a clinical co-pilot that automatically reviews the chart, recommends diagnoses, and drafts the notes for clinicians. And really the superpower here is both where we sit in the workflow and our ability to impact patient safety. So we're all the way upstream. Before a physician even sees their patient, we're able to review everything that's in that medical record, be it 10 years of history or if they've only been in the hospital or clinic for a visit or two. And by doing that, we're able to surface things that might otherwise be missed. So to date, we've already recommended and had physicians accept almost 2 million diagnoses that would have been overlooked. What this means is a lot of our physicians tell us that we're now at a point where it'd be irresponsible not to use Regard. There are so many needles in the proverbial haystack that it's too easy for things to be overlooked. And so I think one of the things we're really proud of is a lot of our physicians tell us Regard's their AI resident. It's doing all of that grunt work, it's doing all that pre-work, those few hours the night before for pre-visit planning, or in the moment where you're writing your inpatient progress note or your discharge summary. How do you make sure you're not missing anything? That's been a really valuable tool for us, and it's really fueled pretty incredible growth this year for us as we are targeting about 4 to 5x ROI or ARR increase just this year alone.
Excellent. Thanks, Nate. Pangaea, you up next.
Thank you. Very good afternoon. My name is Dr. Vibhor Gupta, and I'm the founder of Pangaea Data Limited. I come from a background in medicine and computing. We provide a software product to clinicians in both healthcare and in the pharmaceutical industry to help them characterize patients based on their data and based on clinical guidelines that clinicians use otherwise manually in the clinic. And by doing so, we've been able to help clinicians find several times more undiagnosed and miscoded patients. Our superpower is to be able to use clinical guidelines as opposed to being biased by any kinds of input data that might exist across different healthcare providers and pharma companies. And therefore, the use of these clinical guidelines combined with AI allows our end users to find these patients and, most importantly, be able to explain the results on the basis of which they are finding these patients and shortlisting them for screening, and thereby realizing the true promise of preventative health and precision medicine. Thank you.
Great. super tight. Ellipsis Health.
Thank you. It's really good to be here. I read up on all of you last night. It was amazing to be here. Good to see you, Grace. Good to see you, Shiv. I know you guys somewhat personally, so I can comment on. Grace, you're doing just an amazing job what we do. I think that's a really good description. I think the way sort of we talk about Ellipsis Health are sort of three fundamentals, right? I think that AI is only good if it's invalidated and being used in real time and real life. So I think what we focused on very early days from year one is sort of validation, validation, validation. I just came from the Mayo Partners meeting. It's all about AI with credibility. We can do all AI work in the garages, right? But if it's not in use in real life, it does not matter. So for Ellipsis, I think there are sort of three things I would talk about. One is sort of we have rolled out our co-pilot for mental health, right? So every single clinical encounter with a primary care nurse, case managers, Ellipsis Health is doing ambient sort of work, right? Which means that it reduces the friction, right? Healthcare cannot be about friction. So we're the only company in the space doing ambient sort of co-pilot work, number one. Number two is it matters we serve. It matters to work in real life. So we are, I believe, to the best of my knowledge, is the company who's only published about 8, 9 peer-reviewed papers. Does it work across ethnicities? Does it work across mental health, non-mental health calls? Does it work MA, non-MA patients, right? Where does it work? Show us the proof. So we're very proud to show that, we've done that, not just with our own validation. We obviously have a large, probably one of the largest label data set, but also in real time with real customers, right? We are commercially now working with the largest of payers, one of the largest hospital systems, and more announcements will be coming out this time. So I think for us, it's about science, it's about clinical validation, it's the data set, it's proof points on the commercial side, right? And I know that at Bridge, you guys have done amazing work and it's a great partner. So we're looking forward to partnering with other folks who have the similar clinical and science proof points.
So let's talk, I want to know more about AI for mental health, which is what you guys do. So give me a specific use case where your AI has been deployed and where the clinicians, doctors, analysts are basically, you're giving them their day back.
That's right. So we'll be publishing a paper with one of the largest Blues plans. You'll see sort of doing a case management call. Can you listen to those calls and do assessments in real time, right? Again, this is not a voice journaling product. It's actually a co-pilot on case management calls. So what you'll see, the paper come out that was done is around, are the algorithms and validity robust across ethnicities, demographics, age, gender, socioeconomic brackets, right? All of that. So with the results that we received with one of the largest Blues plan, it is now going to scale across, again, I can't really disclose all the names because of the clients, but major national payers and largest hospital owner in the world.
Okay. All right, great. Thank you. Abridge, you guys are up.
Thanks, Mark. I'm Shiv Rao. I'm the founder and CEO of Abridge. It's a privilege to be here with you and everyone else here today. We use generative AI to summarize and structure medical conversations to help unburden clinicians from their clerical work and also help patients better understand and follow through on their health. At the end of the day, I think our whole thesis is based on this idea that healthcare is not about technology, it's about people. And when you think about what people are doing in exam rooms, whether it's urgent cares or hospital rooms, they're having conversations upstream of all the diagnostics, therapeutics, whether it's coding or risk adjustment or clinical trials, upstream of everything, experiences and even outcomes, upstream of everything, there's usually dialogue. And so what we do is we structure and summarize that information so that clinicians like me, I'm a cardiologist, can really be in the moment and focus on the person in front of us, the most important person, the patient. So a couple of weeks ago when I was seeing patients on a weekend, I remember after every single visit, I'd have to think about writing a note inside the medical record so people on the care team could sort of understand my thought process. I also had to go through drop-down menus and find diagnosis codes so that we can keep the lights on inside the hospital system for revenue cycle and for billing. And then there's the patient, the most important person in this whole equation. They're going to go on the portal. And in my case, they're going to see a term like transcatheter aortic valvuloplasty, which means for the next couple of weeks, I should reasonably expect emails or inbox messages or phone calls asking, what's that word? What do you mean by that? So when Abridge is a part of the conversation, we're going to create that draft. When I swivel my chair, my note is there inside the medical record, and I quickly trust and verify. We see in some cases it takes 28 seconds to quickly trust and verify that note. We're saving people up to 3 hours a day in primary care when the note draft is ready in front of them. But it's not just the note, it's all the other downstream workflows as well. But certainly a big part of the founding thesis and baked into the name of the company as well is that now we can also be an extension of every clinician's best intention to be there for their patients even when they're not in front of them, because these note summaries that we generate can be translated at a level that really helps them go back to those moments and hopefully be the healthiest versions of themselves.
Great. Very, that was tight. Thanks, Shiv. Carenostics.
Hi, my name is Bharat Rao, and I'm the CEO and co-founder of Carenostics. Carenostics is a mission-driven startup that has developed an AI platform that identifies undiagnosed, undertreated, and underserved patients from existing EHR data and will prompt clinicians to intervene within their current workflows and to cause early intervention on such chronic disease patients. What's a superpower? We're the only AI player that has demonstrated the ability to generalize by learning high-performing models across chronic diseases from everyday EHR data. Our platform can expand rapidly to a new therapeutic area. Within 3 weeks, we can go learn the model for a therapeutic area, which gives us a competitive edge over point solutions that don't scale or generalize. Specifically, we learn localized high-performing models that using the structured and unstructured data in the EHR for each health system that are tailored to the local care practices, the data practices, and the population for each health system without any data having to leave the health system. Our last superpower and unfair advantage is our team's deep experience in healthcare AI. Our team, which we had all previously worked together, had deployed healthcare AI at over 1,000 health systems worldwide, serving millions of patients every month. And now we are ready to bring the same revolution to chronic disease.
Great. Okay, good. So we're going to get to the second question. And remember who the audience is. It's judges. They're
Jump in here. Mark, I don't think I've had a go at the first
question.
Oh,
why did I forget you? I went right past that amazing logo. All right, Neil, take it away. This is Skin Analytics.
Yeah, thank you very much. My name's Neil Daly. I'm the founder of Skin Analytics, and we have built an AI as a medical device that's able to identify skin cancer, pre-malignant lesions, and benign lesions from an image. We have built one of the world's only autonomous diagnostic algorithms that has been certified for use. And we have an accuracy of about 99% for skin cancer identification, and we can identify about 76% of the benign lesions that we see. What that does is it now enables us to work with dermatologists and allow them to focus on the patients who need to see them the most. It turns out to be important because skin cancer is the most common cancer that we have around the world. And we have roughly half the dermatologists that we need to deal with the volume of patients that we need to see. So waiting lists are anywhere between 3 and 6 months across the US, and in the UK where we operate, it's much the same story. So using our technology, we have been able to dramatically reduce the wait times. We've been able to effectively take the haystack, make it significantly smaller, get the right patients in front of the right doctor at the right time to get the right outcome. So our superpower is really translating artificial intelligence and building it into clinical pathways in a way that delivers benefits to patients, but also to the organizations that are servicing patients. We're in 15 hospitals across the NHS now in the UK. We've seen 67,000 patients and found thousands of cancers. So we see our superpower as really focusing on getting those outcomes for patients.
That's great. Glad I didn't miss you. Okay, what's the second part of this? We've got another 10 minutes. So think about, hi, I'm a judge. I want to vote for all of you guys. I only get to basically, only 3 of you get selected. So in under 30 seconds each, I want you to say, why is the problem you're solving this year, in the year of AI, basically the problem that the judges should vote for, because in the next 3 to 5 years, you guys are going to be $1 billion company. Because remember, you are the cool company. We stole this idea from Gartner Group. The rising stars are the next cool companies. I want to know why you're going to be $1 billion company, why this matters, and why this is your year. So I'm really this is a little more barking for you guys, but it's actually what the judges sort of have asked us for. So we're going to go in reverse order now. That way, Neil, I'm not going to forget you. Okay. So you got, all right, let her rip. Let's see what you got.
Brilliant. We're solving for unnecessary deaths from skin cancer, and we're solving for patients waiting for 6 months to see a clinician. We've proven with our technology that we can help reduce wait times. In one of our hospitals, the average wait to see a dermatologist went from 14 days down to 3 days. We've helped a number of hospitals across the NHS reach their cancer wait time targets, which is the goal to see patients with suspected serious cancers like melanoma within a certain period of time. And it's the way we measure the success of UK hospitals. We've had hospitals that are only be able to see 25% of their patients, and we've got them up above 90%. So this year, we really are helping unlock the ability for AI to augment clinicians and really, as we said before, focus on the right patients at the right time.
Excellent. Thank you. Carenostics.
The World Economic Forum has identified chronic disease as the #1 crisis in healthcare. 90% of the US, of the 4 trillion US healthcare costs are driven by chronic disease. A study from the Annals of Internal Medicine showed that if a doctor was to follow all the preventative and chronic care guidelines, her workday would be 27 hours long. What Carenostics does is help doctors identify the critical areas to focus in their 6 minutes with the patients. And we do this because our AI results are really good and because our adoption is high. Some numbers. We tripled the number of undiagnosed CKD patients, chronic kidney disease patient found, several tens of thousands of patients in single health systems. Treating CKD early can delay dialysis by 25 years. We found 20 times more the number of patients with severe uncontrolled asthma. Treating these patients proactively can reduce the 1.8 million ER admissions due to asthma every year. And this is just the beginning. But most importantly, AI alone doesn't matter. Our results are being accepted by the physician. We have 70% adoption. And the paper was just published, was just accepted by the AMGA. 70% adoption of our AI recommendations by physicians at the point of care.
Excellent. Abridge.
We are in the middle of a public health emergency on the other side of the pandemic. Clinicians are burned out to the point where they're leaving the profession. There was a survey conducted by the AMA last year that suggested that 2 out of 5 doctors want to leave medicine in the next 2 years. There's a separate survey that suggested that over 60% of clinicians are burned out. Hospital systems had one of the most brutal years in history last year, to the point where any number of community hospitals are shutting down. That means patients aren't getting seen. That means we're as a society, we're not delivering one of the core sort of aspects of what it takes to be a healthy, functioning kind of country. And hospitals can't flex their leverage in the same way they could before. They can't aggregate more clinicians to sort of raise prices in the way they could before. And so where they're left is they need to find a way to generate more volume. They need to find a way to be more productive, but they can't do that because these clinicians, of course, are burned out. It's just going to drive more people away. And so they need technology. And this is a historic moment. It doesn't feel like tailwinds. It feels like an absolute tornado, because on one hand, we have this tailwind around staffing shortages and burnout. And on the other side, we have this other separate tailwind around generative AI, because all of us know, thanks to ChatGPT, that this technology can create so much value, not just personally, but even more than that professionally. And so that's where we're sitting, which is at the intersection, because we're leveraging generative AI to help clinicians be superheroes and help them be the healthiest versions of themselves as well.
Right. So really harnessing the Gen AI wave, 100%. Ellipsis.
Thank you. Well, I think that as we all know, it takes 11 years from the time of your symptoms to getting care. And part of that is the assessment issue, right? The assessment is a fundamental issue. And for us, what we're sensing in the market, voice is not an afterthought. Voice is the thing that's happening now, whether it's Microsoft or Oracle or Google, name it, right? And then you talk about Epic and Cerner and Meditech, they're all working on voice, primarily on transcription, right? So for us, I think that the key things that we have done very well, one is the scientific and clinical rigor of both our acoustic and semantic model, number one, right? We have done that in real time. Our minimum projects right now are about 100,000 calls right? So we're not doing small POCs. We're actually about to scale with very well-known folks. Number two, that means that as we go through the enterprise level contracts, we're looking at millions and millions of calls that we're processing on the assessment side. Number two, which is something that I'm personally very vested in, kids. We have started working on kids, adolescents, a study. So sometime next year, we're going to have the results from adolescents. So all of a sudden, if you think about it, we're going early, adolescents to all the way through, right? On every single case management call that can happen or nursing call with real customers so that we can detect early and intervene early. As we do that very well with sort of the top players, we are going to help think through how do we help manage mild to moderate. So we think about it as a platform play as opposed to just a tool play.
Okay, great.
So moving on here.
Excellent. Okay. Pangaea.
Yes, thank you, Mark. So if we just consider deploying AI at a healthcare provider for a clinician, two challenges remain. Number one is privacy of data, and number two, explainability. The fact that Pangaea is able to find these undiagnosed and miscoded patients based on clinical guidelines that clinicians use manually and spend 30 to 40 minutes by being able to review patient records based on these clinical guidelines, that's a big saving because now you're able to automate that entire process using Pangaea. Now you come to the other challenge, which is who's going to fund this? And the fact that Pangaea has been able to demonstrate how it is able to scale the application of its product across 7,000 hard-to-diagnose conditions at 140,000 healthcare providers without needing to touch the data or without needing the healthcare providers to sponsor it, that's a big element of its scalability. In one study, we were motivated by two pharmaceutical companies, for example, who were very interested in characterizing patients who had cancer cachexia, which is a form of muscle loss. It's terribly underdiagnosed in 90% of the patients. And here, working with the NHS in the UK, we were able to find 6 times more, which is about 200,000 more undiagnosed and miscoded cancer cachectic patients without needing to move or touch the data from the NHS. The fact that the NHS got all of this for free and they were able to bring these patients in for treatment and connect them with nutritionists was a big bonus because they were able to demonstrate being able to halve the cost of treatment from 10,000 to 5,000 pounds in each patient, leading to about £1 billion savings annually just for one condition. Now you multiply that by 7,000 hard to diagnose conditions, that's a big saving. And also a big collaboration between pharma and healthcare in a financially sustainable manner.
Great. Okay. Well, you definitely, you nailed it. Regard.
Yeah, I think in this environment where hospitals are closing and hospitals are slashing budgets, all technology innovation needs to have a real ROI, right? And right now, what we're seeing is based on it's really hard to get a CEO to write a check in a hospital, but we're seeing now less than 10 sites last year to now north of 100 plus live and contracted sites using Regard. It's proven that there's an opportunity not only to generate revenue, we're generating about 100K per physician who's on our platform in net new revenue to help keep the lights on. So now you've got the CFO really interested. But next is this tool is only successful. Our Copilot's only successful. Physicians want to use it. We have 80% adoption across all of our physicians. When someone learns how to use Regard, they use it every day on every patient forever. We track our forever user rate. And the last piece here is that we can't lose sight of the patient, right? That's the most important element here. And the fact that we're driving better safety for these patients means now the chief quality officer is really excited about this tool. So the fact that you have the CFO, the CMO, and the CQO all fighting for the same tool leads not only to runaway growth, but frankly, a huge shift in how people should be thinking about their patients and care and documentation. And as we see the explosion of data over the coming years with ambient tech capturing more dialogue, remote patient monitoring bringing in more data, with genomics bringing in more data, all that's going to land on the shoulders of physicians. Until you have a tool like Regard, an AI Copilot or AI medical brain in the medical record to help you sort through that, we're only going to continue to drown in this data. So having a clear ROI and a clear path to unlock the value of your data, it's going to be necessary for tools like Regard for hospitals to exist full stop and to deliver the care that we know we can as a society to our patients.
Excellent. Thank you, Nate. Imagene.
Thanks, Mark. So 350 lung cancer patients will die every day in the United States. That's a number that's unacceptable because 50% of those lung cancer patients are not even getting tested for molecular biomarkers. So at Imagene, we're going to provide equity in the market by allowing more patients to receive molecular testing so that every patient can ultimately get on the most effective cancer treatment. What's interesting is we've proven our solutions are highly accurate when compared to next generation sequencing methods, and we can provide those results in minutes instead of weeks. And that eliminates the unnecessary wait times just to even start treatment while the cancer continues to grow. And I believe our future is even brighter because within the next few years, we're going to be able to answer even more exciting questions using that same tumor biopsy image to answer questions like which patients will respond to therapy or who will develop a recurrence or resistance mechanism. So we're ultimately going to be able to use our technology to achieve the goals of precision medicine in cancer care.
Excellent. Well done. And Grace, save you for last. Let's hear from Kintsugi.
Thank you. I think this question is really important. We get paid on outcomes, and it is quite important for us to be able to deliver on such. We've been really fortunate to be working with the top 3 of 5 payers and a number of health systems that are moving to risk-based value contracting. And with our current models achieving 91% sensitivity on 95% confidence interval for detecting signs of severe depression, our ability to stratify these patients become particularly important as we think about how few of these screenings take place. And when we look at expanding some of our work with our enterprise clients and payers, they are today seeing about 1 in 3 adults struggling with depression and or anxiety post-pandemic, and 1 in 2 youth that are also struggling in a similar fashion. When we look at the Medicaid population, a population that we are expanding to, there's nearly 100 million individuals on Medicaid, which are shockingly never screened at all. And so with our latest sort of engagement with these large payers, we found 30% more detection than the PHQ-2. We've obviously been able to demonstrate seamless data augmentation with clinical call centers, care management platforms, remote patient monitoring, and telehealth applications that are able to ingest and integrate with our API in a very low risk fashion. This also provides additional longitudinal data that really helps understand whether the treatments are as effective with the level of ROI that is expected. And all in all, I think what this says to us is that our impact really is designed and projected to scale about 1,700% year over year through 2026. And we do believe that this will have meaningful impact on the growth rate for virtual care at large.
Excellent. Thank you, Grace. Paul, you guys have done an amazing job. First of all, it's, look, you're all rising stars. There's no question in my mind.
Hi, I'm Anand, Iyer, Chief Analytics Officer at Welldoc. Our digital health platform provides multi-condition support for individuals living with chronic conditions and is powered by Welldoc's advanced AI engine. A major challenge in healthcare is addressing the needs of a growing population with chronic conditions amidst continued resource and access constraints. Welldoc's platform makes care models more efficient and scalable by integrating directly into care pathways to support clinical decisions, all with personalized digital coaching only possible with AI. One healthcare ecosystem challenge the Welldoc platform solves for is taking the vast amounts of data now available to us from advancements in devices like continuous glucose monitors with real-time glucose updates and making it meaningful with pattern detection. The Welldoc engine makes correlations between siloed health data, actions, and progress over time, so individuals can self-manage their conditions and build better habits while providing information to support care team connections, interventions, and clinical decisions. The Welldoc AI engine leverages both rules-based AI and adaptive machine learning to provide personalized insights, even on things like medication management, and to enable improved health and outcomes. Welldoc stays ahead of the innovation curve and strengthens our AI to support things like CGM-based insights and pattern detection, which is possible through our clinical and regulatory rigor and extensive research. Welldoc is actualizing what AI can mean in healthcare, and we continue to evolve our AI to provide safe, effective, equitable, and actionable insights, stronger predictive models for chronic care prevention, and more seamless personalized support for broader populations.
We are proud to participate in the Digital Health Awards by the UCSF Health Hub. Our solution is QP Prostate. QP Prostate is a tool that uses AI to streamline the process of MRI interpretation in prostate cancer patients and also helps radiologists in the diagnosis of this disease. The tool is cleared with the FDA 510(k) and also has CE mark and UKCA certifications. Considering the high burden of prostate cancer in patients, we are glad to be part of the solution to this problem by providing a tool that can help in the detection of prostate cancer earlier, to increase sensitivity in current processes, and also to decrease the number of unnecessary biopsies. Quibim has many superpowers, but the key ones are harmonization and segmentation. Harmonization is the way we standardize the images that come from different vendors, from different machines, and we generate a standardized image quality in the company using AI. And segmentation are the AI algorithms that we use to identify the organs and also the lesions. In our case, the organs are the prostate gland and the lesions that we can find inside the gland. We ensure that with our algorithms, we are providing the highest accuracy of the market. We really deserve this award. Time is now. Quibim has done a significant investment in the US, but not only for this, also because right now Quibim is not a workflow company anymore. We are a predictive company. We are not only detecting prostate cancer lesions, but we are also predicting the outcomes, so we can early detect patients at risk and take action.
Hi, I'm Jim Min. I'm a board-certified cardiologist who practiced for about 20 years, and I am the founder and the CEO of Cleerly. We're a healthcare company who wakes up every day with a purpose to try to create a world without heart attacks. Last year, we were honored to be selected as a finalist in the new Health Application of AI category. And this year, we're here to share with you some of our progress in our application for the best use of AI in health tech. Our solution here at Cleerly really aims to personalize cardiovascular evaluation of patients. Our technology leverages artificial intelligence and a series of machine-learned algorithms that perform complex processing of non-invasive low-dose CT scans. This allows physicians utilizing our technology to really personalize medicine and personalize the care. I think that our superpower at Cleerly is really in the obviousness of the solution. When we looked around for the most successful preventive care paradigms, what we found was that they use some form of imaging to directly visualize disease. We realized that the field of cardiology has not done that. We can eradicate heart attacks. The problem is not that we lack treatments. The toolbox is heavy. The problem is that we lack the ability to identify individuals before the events occur, because the majority never have any symptoms. They feel fine one day, and then suddenly they have a heart attack the next day. We need to identify those people, and the only way that we can do it is to get to the root cause. In this regard, Cleerly's technologies directly measure somebody's actual disease on a patient level, on an artery level, on a segment level, even down to the lesion level, where we can quantify and characterize the type of disease that is building up within an individual's arteries, thus focusing the care in a personalized or precision manner rather than the population-based associative approaches that we've used in the past.
What makes Butterfly special is they actually put ultrasound on a chip. They're the first company to be able to commercialize that. And why is that significant? So all other ultrasounds on the planet actually use something called piezoelectric crystals. And the size and the shape of those crystals create the ultrasound beam that's then used to image the body. It requires different probes to create different frequencies and different shapes to scan different parts of the body. By putting it on an ultrasound chip, we were able to scan the entire body with a single probe. We could create linear phase and curved array probes in a full range of frequencies. So instead of having a big cart and multiple probes, you had a single probe that would fit into your pocket that would connect to a smartphone.
Now,
and we're
here
able
in
then
their
to
own
leverage
words,
the $1
why
trillion
they should win.
in industry to be able to sell this device for $2,000. So instead of a $50,000, $100,000, or $200,000 ultrasound machine, carts lining up the wall, you now had an ultrasound system in your pocket that you could pull out. And for the first time ever, ultrasound became personal. And when you start to think about the power of imaging information and how it can transform care decisions, I saw the value proposition of what Butterfly could become. And whether you're from the most advanced health system in the world to the most remote regions of the globe, this device changes care. If you can use your phone, you can use the Butterfly. We have a secure cloud that allows image sharing across the globe. We're up on the space station now. We're in the remote regions. We're in more than, a whole host of professional sports franchises on the sidelines. It's the reach is, and it just transforms the way you think about the globe. It gets much smaller when you start impacting all these different people in different ways. And then I think the most exciting part of it is where we're going with artificial intelligence tools. I mean, what an incredible field. We're now developing tools that will take a novice user to guide them to get a good image and help doctors interpret those images. And we're developing pathways so that patients themselves can scan themselves in the home to monitor chronic conditions and stay away from the emergency room in the hospitals.
Hi, my name's Kanishka, and I'm the co-founder of Carenostics, a healthcare AI startup dedicated to addressing the underdiagnosis, undertreatment, and health inequities of chronic disease. Personally, my grandfather unfortunately passed away from chronic kidney disease and didn't know he had it until his kidneys had already failed. Sadly, this is a common story, with more than 100 million Americans estimated to have an undiagnosed chronic disease, many of which, like my grandfather, only find out once preventative treatments are no longer effective. It's for this reason I co-founded Carenostics. And what we do is two things. One, identify patients with undiagnosed and undertreated chronic disease using AI. And two, activate clinicians to intervene on these insights. We do this by deploying our AI platform at partner health systems, where we take in all the existing data, learn these models, and feed it back into existing clinical workflows to activate clinicians. The results have been tremendous, most recently showing across multiple therapeutic areas like chronic kidney disease and asthma, that we can find 4 times more patients than current practice at a 5 times lower false positive rates. And this has been deployed at multiple massive health systems, such as Hackensack Meridian, the largest health system in New Jersey, and the VA. Our superpower is our team, which, unlike new adopters of AI, has over 100 years in healthcare AI expertise, launching more than 20 products at over 1,000 health systems worldwide. It's this expertise that allows us to tailor these models to individual health systems and rapidly expand to new therapeutic areas. I believe Carenostics should win because we not only build AI models, but actually activate clinicians to intervene on these insights. Most recently, an AMGA paper of ours showing that we activate clinicians 5 times higher than baseline rates. And it's this combination of AI and activation that will achieve our vision, driving every clinical decision with data and AI and stopping the story of my grandfather from repeating itself.
With healthcare systems under strain, doctors are under pressure to somehow see more patients and improve outcomes. They can do it, but they need help. Currently, documenting each visit takes far too much time, not to mention following up with patients and their families. This leads to burnout and staffing shortages, which ultimately impacts patient care. But Abridge can help. Abridge uses AI to automatically turn medical conversations directly into documentation for doctors, then shares follow-ups with patients to help improve care. It's the two-pronged solution that healthcare systems urgently need, and it's simple. With Abridge, doctors and patients simply have conversations like normal. Abridge captures every word. Its cutting-edge machine learning then summarizes the medically relevant details and generates structured documentation adaptable to a variety of clinician and enterprise contexts. So if the doctor uncovers new symptoms, orders a change in medication, or recommends a behavioral adjustment, that information is documented accurately in real time. Abridge structures, codifies, and shares information directly with your EHR and other systems, so data gets streamlined organization-wide. It can also share those insights with patients and their families, even highlighting key takeaways and next steps that help them stay on top of their health. This dramatically reduces a doctor's workload and stress, but it also improves patient outcomes. Because now, everything their doctor says, hears, or notices enriches patient care. Medical documentation that saves time. Patient communication that saves lives. Abridge. Schedule a demo today.
Ellipsis Health has created the only clinically validated vital sign for mental health. By harnessing the unique power of the human voice as a biomarker for mental health and artificial intelligence, we generate a clinical-grade assessment of the severity of anxiety and depression. This creates an objective, personalized, and scalable clinical decision support tool. Now, through this innovation, we can identify and monitor people in need and connect them to personalized care. So what's our superpower? It's our science. We are committed to leading the industry in clinical and speech technology research, establishing best practices, and contributing to the impact of voice as a biomarker for mental health. With 7 published papers in top peer-reviewed journals, we employ the latest deep learning architectures for both natural language processing and acoustics. In contrast to approaches that rely on feature design, our cutting-edge machine learning methodologies yield superior performance, robustness, and scalability. Our models are also speaker independent. No baseline is required, and they are trained on diverse data sets. We don't need to store any data for our models to optimally perform, maintaining both data privacy and security. So why should we win? Well, over 30% of the population and 50% of those 18 to 29 are struggling with mental health disorders. We are facing an epidemic impacting the well-being of society. Despite the enormous need for mental health care and a growing shortage of care professionals, we are relying on scalable and outdated assessment tools. There has been no vital sign to screen for depression and anxiety until now. Partnering with payers, providers, employers, and digital health companies, we are positively impacting the quality of care, shortening the time to diagnosis, driving workflow efficiencies, reducing costs, and improving patient outcomes. At Ellipsis Health, we are connecting the dots to a happier and healthier future.
Hello, my name is Dr. Vibhor Gupta. I'm the founder of Pangaea Data, headquartered in London with an office in South San Francisco and Hong Kong. We provide a software product which combines medical knowledge and AI for clinicians in the pharmaceutical and the healthcare industry to help them characterize patients, which is proven to discover more undiagnosed, misdiagnosed, and miscoded patients. Our superpower is to be able to do this across 7,000 hard-to-diagnose conditions in a scalable manner without the need to transact data. In one example, we were sponsored by 2 pharmaceutical companies from the US and Japan who wanted to apply our product to find more cancer patients with cachexia. Working with the National Health Service in the UK for this study, we showed how we were able to discover 6 times more cancer patients with cachexia compared to generic natural language processing and metadata-based approaches. The discovery of these patients also showed how physicians were able to halve the cost of treatment from £10,000 to £5,000, which in the context of 200,000 such patients annually meant a potential saving of £1 billion, and also 6 times more revenue for the pharma companies and 6 times larger pool of patients with an improved screening success rate from a clinical trial perspective. I trained in oncology and infectious diseases. My co-founder, Professor Ike Guo, is the engineer on the team. We've raised more than $200 million through our academic research over the last 20 years and are proud to be advised by Lord David Pryor, former chairman of NHS England, and Mr. Andy Palmer, former CIO of Novartis. We're also very grateful to Microsoft, who made us a top-tier partner recently and are scalably applying our product across pharmaceutical and healthcare providers globally. Please do contact us through www.pangaeadata.ai.
Hi, I'm Dr. Dilraj Khalsi, Clinical AI Lead.
And my name is Neil Daly. I'm the CEO of Skin Analytics. At Skin Analytics, we use artificial intelligence to diagnose skin cancer. We're able to take that technology and package it up into patient pathways that deliver significant capacity gains to dermatology departments across the world. What we do is try and make sure that we can see more patients faster so that we can focus on early detection when we know we can have a positive impact on survival rate from skin cancer.
Our AI as a medical device analyzes dermoscopic images. They're the same kind of images your dermatologist would use when assessing your mole for the risk of skin cancer. It can then stratify out high risk from low risk lesions and therefore create the capacity gains that Neil alluded to. What we've found is that it's remarkably accurate, detecting 99% of skin cancers while identifying over 3 out of every 4 benign lesions which require no further management.
We launched the world's first skin cancer pathway with artificial intelligence in April 2020. And since then, we've launched the world's first autonomous AI skin cancer pathway. We've seen over 50,000 patients now in the National Health Service in the UK, which means that each month we see more skin cancer patients than the largest hospitals in the country. We've shown that we can deliver that capacity benefit that we talked about, that we have operational resilience, and have very, very high efficacy. Taking all those elements together, we've been able to really deliver a step change in care pathways in the United Kingdom. We're looking forward, with our strong commitment to ensuring that patients get better outcomes, to doing the same in the US. We hope that we can build on a national contract we've just been awarded with the National Health Service in the UK to really bring our technology onto the US soil and benefit US patients very, very quickly.
Hi, my name is Dr. Francisco Alvarez, physician and Vice President of Clinical Operations at Regard. Regard is an AI-powered clinical co-pilot. Many of our users call Regard their AI-powered resident. Regard is the first product to the market to make clinical notes and documentation an asset to clinicians rather than a burden. Our solution scans the electronic medical record, surfacing critical patient data, recommending diagnoses, and automating clinical notes for physicians. Regard is different from other AI and health tech companies for 2 core reasons. First is that we have built a solution that clinicians actually love to use. Regard was built to advance the practice of medicine by empowering clinicians. We have seen that 72% of clinicians trained on Regard continue to use it in their daily clinical practice, decreasing time in the medical record by 20%. Our second core differentiator is that Regard has been able to provide a clear financial impact to health systems, saving $10 to $25 million per year just on their first department on Regard. Our superpower at Regard is our laser focus on providing a world-class clinical experience. Our hospital partners tell us they've never seen a product improve faster. Even users who've been using Regard for years frequently tell us how much faster and smarter their workflow is. The best part is, we're just getting started. We believe Regard should win because we are driving value to all parts of the health system. Regard delivers meaningful AI in healthcare that is reducing burnout and enhancing patient care.
The main problems with molecular diagnosis today are long turnaround times, limited biopsy tissue, and technological and interpretation limitations with next-gen sequencing. When factoring in low testing rates, about 64% of lung cancer patients receive suboptimal treatment. Our solution is a revolutionary AI technology that can provide molecular results within minutes using only a digital H&E slide image, reducing turnaround times, optimizing the use of available tissue, and streamlining clinical workflow. With millions of new cancer cases each year, the need for a cost-effective, rapid, accurate, and scalable molecular diagnosis is clear.
Most guidelines emphasize the need for molecular testing for actionable biomarker before initiating treatment. AI has emerged as a powerful tool to address these challenges and facilitate molecular profiling. As a scientist, I'm eager to conduct further research to establish more proof of points to advance the integration of AI-based molecular profiling into clinical workflow.
You know, behind all of those numbers and graphs and statistics, we have to remember that there are real patients, and for them it's much more than just like life or death. It's also about the quality of life. Just imagine the pressure that the patients are dealing with while waiting a month for the results, and their families, by the way. So I think that it's our duty to do whatever we can to provide them the peace of mind, knowing that they receive the right care at the right time, at the right place, while fighting the biggest fight of their life.
Hi, my name is Grace Chang, founder CEO of Kintsugi. And at Kintsugi, we are developing novel voice biomarker software to detect signs of clinical depression and anxiety from short clips of free-form speech. Today, we are integrated into clinical care management call centers, telehealth applications, and remote patient monitoring apps. We are quite excited to be speaking around the ability to improve access and quality to mental health care. Our superpower is that we have quite a deep care for being able to solve this problem. Both myself and my co-founder have faced the challenges of not being able to get access to care. And as somebody who has experienced burnout, and for her postpartum, not getting access to care is one of the most critical hurdles in being able to solve this mental health care crisis. We are very pleased to be able to present to the UCSF team in terms of why we think we should win. We think that there are a number of really extraordinary mental health care solutions. We pride ourselves in having an exceptional technical team. We have won the Forbes AI 50 as well as being named Fierce 15 for 2023. We do believe that our unique take at being able to create the scaffolding and infrastructure to allow people to not only be identified and stratified through Kintsugi Voice, but connected to our marketplace of mental health care providers is a unique end-to-end solution for payers and health systems that are moving to value-based care to close these very important mental health care gaps.